There. Thank you so much for joining me. My name is Beth Parkes. I've been a registered dental hygienist for 20 years, and I am the clinical affairs manager for Curion. Today, I want to take the opportunity to talk about one of my favorite subjects, which is instrumentation. I have the honor of introducing you to the LM line of instruments. LM is a company that is based out of Finland, and Curion is the exclusive distributor here in Canada of their instruments. The one big feature that I really like about this line is the focus on ergonomics. So I want to start by talking about the ergonomics behind this line of instruments, and then we'll talk about a couple of the different features. So the first thing, I want to share with you a quote that I found here from the FDI. According to World Dental Federation, FDI, ergonomics in dentistry should strike a balance between keeping the dental practitioner healthy and providing efficient treatment. Sometimes we'll find an instrument that may produce great clinical results, but at the end of the day, we're feeling that muscle fatigue, that repetitive strain we're feeling is heightened by the end of the day because the instrument maybe is doing a good job clinically, but for us as the clinician, it's not serving us well. So it is a challenge to find an instrument that really has the synergy between good clinical outcomes and ergonomic benefits. The FDI goes on further and in their guidelines states that the least amount of muscle load and pinch force is needed when dental professionals use instruments with a large diameter, textured handle, and a light weight. So those three components are something that the company took very seriously and incorporated into their design. So I want to look together a close-up look at these instruments. So here, there's a few things that I want to point out. The first is very lightweight. When I initially saw these instruments and was introduced to them, one thing I loved was this metal to metal connection. And you can see that straight through the center of the instrument is this metal alloy rod. So oftentimes when we're using our instruments, the tips themselves are inserted or sort of screwed into the ends. Whereas with the LM instruments, we have a metal alloy rod that connects the two. So all the vibrations that you're feeling from the tip aren't going to be lost or maybe lessened by the attachment. You're going to feel it going straight through the instrument handle. In addition to that, the silicone non-grip handle helps to reduce the amount of pinch force that you're going to be pushing on. Some of that is subconscious. If you feel the instrument is going to slip out or you're afraid that it's going to slip out, the natural tendency is to pinch down. So by having this non-slip grip, you're going to naturally feel less inclined to add all of that force. In addition to that is that wider handle, which comes from the FDI statement we just looked at together. These have a wide diameter and a tapered handle as well. So the beauty of a tapered handle is when you are debriding maybe one tooth away. So if on your typodont you are about, you're fulcruming and you are approximately one tooth away from where you're debriding, you may be choked up on the instrument. That may change if you go to use an extra oral fulcrum and you are more like, you have to kind of imagine where I'd be holding it, but you may be a little higher on the instrument naturally. What that's going to do is actually alter where that pinch force is taking place. Having this synergy between ergonomics and functionality really places us in a great position to apply those key principles of debridement that we learned in school. However, the tendency when we feel rushed, when we have an hour, if we're lucky, to get everything done in one appointment, we sometimes lose sight of our slow, intentional, overlapping strokes and move towards more of a choppy, kind of haphazard motion. When all of these things are in place, we are going to be less likely to stray away from what we learned initially in school. We're going to be able to use brief, biting, controlled strokes with moderate lateral pressure in the presence of calculus. And we don't want to be adding that pressure when there is no calculus. So by having this improved tactile sensitivity that comes from all the features that we just talked about, we're going to know when to use light exploratory strokes, when to apply just very light pressure to remove small bits of residual calculus or biofilm, and when to apply that moderate pressure in the presence of calculus. This is going to help us preserve our muscles, create more comfort for us as the clinician, but also for the patient because we're not going to be applying excessive force because we won't feel the need to. Let's summarize some of what we've just talked about as far as the ergonomic benefits of a large diameter silicone handle. We're going to have reduced pinch force. We talked about the benefits of that flared handle design, less hand fatigue, improved grip. We're going to benefit from that lightweight construction, the solid one-piece construction, metal to metal connection for enhanced tactile sensitivity. I really do love this quote from LM, and it's the focus is on ergonomics in our hand instrument development without losing sight of efficiency. And that really ties in well to the FDI statement we read together. So all of these features are going to help to stabilize the clinician's hand during treatment, increasing the precise control needed and reducing muscle load and fatigue. In addition, we want to choose the right tool for the job. So rapid wear and tear or breakage can be caused by not only technique error, over sharpening, and incorrect sharpening, but also by incorporating instrument selection. So we want to make sure that we are using the right tool for the job. So starting off with our ultrasonics, removing as much as we can with our ultrasonics, and then selecting the right tool for the job at hand, whether that be a sickle, whether that be a universal curette, or our area-specific Gracies. Let's move in and talk about sharpen or sharpen-free. So with the LM line, you actually have the option. If you are someone who is proficient in sharpening, then the stainless steel line may be for you. But in addition to having the skill set, and what I have found to be true is that the sharpening skill is one that causes frustration for the majority of us. So if you are struggling with sharpening, or if you don't have time to sharpen, that is another big issue for us right now, more than I would say ever, is finding the time to be able to sharpen. And if we look statistically at how frequently we can sharpen, that is going to depend on many, many factors. The grade of the metal, the number of times you're using that instrument in a day, in a week, all of those things are going to impact how frequently you need to sharpen. But on average, it appears that what is recommended is every 7 to 10 uses, up to about 14 uses if it is a high grade of metal. So taking that into consideration, and this will be rhetorical, have a little check-in. Is that something that is possible for you, or would something that is truly sharpen-free be a good option? So let's start with talking about stainless steel. So this is the LM Duragrade Max Super Steel. These are instruments that you will sharpen. However, these instruments feature LM's advanced thermomechanical heat treatments, controlled gas atmosphere, and cryogenic processing. With that, it creates this super steel alloy, which represents the ultimate in the field of metallurgy. LM's proprietary alloy produces the sharpest, hardest, and longest wearing conventional tips available. As a result, LM's stainless steel instruments stay sharper and longer than the traditional ones would. They are the highest wear resistance available. They are immune to corrosion. These can be sharpened, but what you'll find is you're sharpening them less frequently because it's that higher grade of metal. We're still going to have all of the ergonomic benefits and that heightened tactile sensitivity that we discussed earlier on. Now, the only consideration, not the only consideration, but one consideration with a stainless steel instrument is the sharpening aspect of it. What we see happening is even for those who are proficient with sharpening, we are slowly altering the initial angulation of that instrument, which challenges the integrity of the instrument over time. Also, what can happen, and what we see often, is that the instruments are being used far beyond their lifespan. So just because you can get a sharp cutting edge of an instrument doesn't mean that it should be used any longer. Have we lost the original design of the instrument? Has it been sharpened so much that the risk of breakage is too high? Sometimes it's great because we feel like, oh, we've created our own minis. But the problem is, has this mini that we've created, does it respect the initial angulation or the original design of that instrument? Or have we created, I don't know, maybe something that you'd find in a prison, right? Again, rhetorical, but good to check it. So that leads me to the sharpen-free line, which I want to talk a little bit about, because this is truly revolutionary and very, very unique. So let's take a moment and talk about sharpen-free. So the dark diamond tips, so these are the dark tips of sharp diamond, you'll notice when you look at them that they do appear different. I'm not sure if you can see that close up, but here is a sharp diamond compared to a stainless steel. So you can see that the stainless steel is a little more silver in color, and then the sharpen-free instruments are a little darker. And they are different. So there is a diamond-like membrane that enhances the already super durable steel that is used underneath the coating. So it is already superior wear, right? But then the 100% sharpen-free instrument comes from this PVD coating that covers the entire instrument. And LM's ultramodern PVD coating process follows the exact geometric planes of the instrument to ensure flawlessly sharp tips and the longest wearing edges possible. So this is going to set you apart as a new graduate or as a seasoned veteran. And the reason it's going to set you apart is because you're going to have more efficient and comfortable experience for the patient and the clinician. For yourselves, you're going to have all the ergonomic benefits that we talked about, and you're not going to have an altered or beveled cutting edge. That's going to produce greater tactile sensitivity. It's also going to mean you're going to use less lateral pressure when you're debriding for your patient. And a couple of the other features of this instrument is the fact that they thought of everything. Even the fact that when you put this instrument down on a metal tray, you're not going to hear that that clang that we all are accustomed to. And for a patient who is sitting in a chair who may be anxious, some of those sounds creates more anxiety. So it's going to be a gentler experience, even from the ears. Okay, they're attractive tools, and not just from an aesthetic point of view, but from a patient's point of view. Those instruments aren't going to become, the color's not going to be altered. They're not going to fade. They're not going to start to look worn and tethered by the end of their lifespan. These have been tested for about 20,000 cycles. So very, very resistant, medical grade silicone. So they're not going to fade on you. They're not going to melt. Really, what you see right out of the package is what you're going to be seeing at the end of that instrument's lifetime. Let's talk a little bit about the benefits of using the sharpen-free. We've already talked about the comfort, but these ones are truly sharpen-free. They are made from an exceptionally durable special metal alloy. The wear resistance is enhanced by a protective micromembrane coating. They can be used like your normal instruments and are suitable for all forms of debridement. And they provide full control and improved tactile sensitivity. And this topic of control is one that I really want to focus on. If we go back to when we were talking about losing sight of those slow controlled strokes that we learn in school, and we move towards, or some have a tendency to move towards more of that kind of choppier, haphazard stroke. Sometimes that happens because we start to lose that sense of control. But when we bring it back to the grip that we're obtaining from these instruments, the original design and integrity of that blade is going to be kept. All of these things are going to lead to greater control, which is leading to less musculoskeletal disorders for us and leading to less anxiety, less discomfort for the patient. Shape and safety is really one of the biggest benefits that I see from the sharpen-free line. That functional safety is going to be maintained for the life of the instrument. We're not going to alter the cutting edges. We're not going to alter the original design. We're not compromising durability. We're going to, if we did have to do those things, if we did need to sharpen those instruments, eventually that is going to increase the risk of breakage. So that's going to be diminished by using a sharpen-free instrument. If we compare the sharpen-free instruments to stainless steel, when we're talking about lifespan, because this is one topic that we really do need to talk about, is the lifespan of an instrument. And as we talked about, with the stainless steel instruments, the temptation is to use those instruments past their intended lifespan. If we follow the guidelines for instruments and proper replacement, and we compare the two, we can see the top line here are sharpen-free. The ideal shape and angle of that instrument is maintained right until the end. And if we compare that to what happens over the life of a stainless steel instrument, is we are gradually modifying the shape and the angle until finally we reach the point where that instrument really has lost that integrity. It's lost the original design. A question does come up, and that is how long do the instruments last? And this is such a difficult question to answer because it is multifactorial. This completely depends on, like we said, the number of times that instrument is being used in the day or the week, the type of deposit you're dealing with, your ratio of ultrasonic use to hand instrument use. All those things come into consideration. But if we start to research the manufacturer's instructions for use and start to pull from some of the materials we have available, we can say that on average, if we had to put that down to numbers, the regular grade of metal scalers and curettes, you're getting about a half year to about a year. And that is with regular maintenance. If we look at more advanced metal alloy scalers and curettes, like we find with LM, you're going to get a little bit longer, like a year to a year and a half. And if we compare that to the LM sharpen-free instruments, you're going to get about a 9 months to a year. I have heard from some that it was less. I think the shortest amount of time I've heard is about 4 to 5 months, but that was, again, a lot of hand instrumentation, not as much of the ultrasonic use and being used multiple times a day. So 9 months to a year is where I'm comfortable sitting with those LM sharpen-free instruments. The last instruments that I want to talk about are the diagnostic instruments, because honestly, I feel like sometimes they don't get enough attention. We often see the scalers and curettes replaced, but clinicians holding on to their older explorers or their older mirrors or probes. So I want to take a moment and acknowledge you if you do replace those diagnostic instruments regularly as well. The mirror we'll start off with. The mirror arguably is the instrument we're holding for the longest period of time. So we're using it for retraction, transillumination, illumination, and indirect vision. And on a subconscious level, if we're holding that mirror all day long and the mirror is not comfortable, we're going to have and be tempted to rely on our direct visions. We're going to become these contortionists, moving our body around, maybe not even realizing that it's because our hand is fatigued, our non-dominant hand is fatigued by holding a mirror handle that isn't comfortable. So make sure that you're getting a comfortable mirror handle as well, knowing that that's the instrument you're likely holding for the longest amount of time during your day. The other instrument that I am going to demonstrate in a moment is the Flex Explorer. So not all explorers are created equal, and LM has come up with my favorite explorer, which is called the Flex Explorer. From a manufacturing standpoint, it is the thinnest instrument that I have ever seen. Very difficult to produce something that is so fine, but it is going to heighten your tactile sensitivity extremely. So I'm going to demonstrate that in a moment. I want to talk a little bit about probes as well. When I was given the opportunity last year to tour the LM facility in Finland, which was a huge honor. But one thing that I was really impressed by was the use of robotics. So when it comes to a probe, there are a couple of things that affect the accuracy of our probing measurements, or why you can have the same patient and two clinicians do measurements on that patient and come up with slightly different results. And there are a few factors from the study that I've attached to this slide here. And they found a few things. Number one was the accuracy of the marking intervals. So one thing you can rely on with these instruments is the accuracy of those markings. And that is because of the use of artificial intelligence. Rather than relying on a human eye, we can ensure that those markings from one probe to the next are going to be consistent. The thickness of the probe, probe angulation, force of probing, subgingival obstruction, root anatomy, the condition of the tissue at the end of the pocket, and pain provoked by probing are also factors. And if you think about all of the tactile sensitivity benefits we talked about before, know that those benefits are also going to relate to your probing. So you are going to have greater tactile sensitivity, which is going to reduce the risk of provoking that pain by putting too much force on the probe handle itself. So just as those ergonomic benefits benefit our scalers and curettes, they are also going to come into play here with our diagnostic tools. All right. So I'm going to take a moment and just demonstrate very, very briefly some of my favorite instruments. I'm going to change my camera here. Give me one moment. Okay, and let's get this into focus for you. So the Flex Explorer is the one that I was just talking about. So let's see if I can get a clear image here for you. All right. So check out how fine this instrument is. I'm going to use a feather-like touch. And when I'm here exploring, I can feel so much more than I ever have before. I wish I had had this as a student. When I was trying to learn the art of that tactile sensitivity, this would have been an amazing instrument. Alas, I did not have it. But now you can see that this would really heighten your assessment protocols and give you that heightened tactile sensitivity to, first of all, find where the calculus deposits are, and then moving through the appointment, checking to see if there's any calculus being left behind. Another instrument that I want to show you here is the Sharp Jack. So when you come and visit us at the booth, which I hope next time you're at a show and you see the Curion booth, please come and you can play with these instruments yourselves. This one is one of my favorites. It's called the Sharp Jack. It is a universal sickle, and I use this instrument everywhere. So I use it in the posterior areas, both distal, coming across the mesial, and I can also adapt it really nicely here in the anteriors. You can see that I like to play in my free time. But here, see how nicely that adapts the anterior as well for all surfaces. Another instrument that I'm going to encourage you to check out is, and this is one of the newest ones to the line, which is their Nevi 1. So on the one end, we have this beautiful sickle. And on the other end, we have a little scoop. So this one is ideal for anterior use. So you can use it anteriorly. And then I love it for stain. So I'll switch my ends. And if there's any stain that's left here, I'm going to use it to remove any of that stain that's left. I also love this for the max anteriors. Imagine we could just move our patient in this way. I love it here. I find that there's almost like these little shovels. Our max anteriors are like these little shovels or these little scoops. And I always want something to just get in here and remove some of that stain that's left over, even after I've used my ultrasonics and hand instruments. I always find a little bit left here. So again, just like we were doing on the mandible, I'll use it in here almost like a little scoop to get rid of any stain, biofilm, or anything that's been left behind. So that's one that I want you to come and see as well. Lastly, I want to touch on the fact that, first of all, I love Gracies. I absolutely love Gracies. And when it comes to mini Gracies, historically, as much as I love them, I was fearful of purchasing them because I knew I was going to wear through them so quickly with sharpening. So now with sharpen-free, and here is an example of, I'm going to use the mini 1314. And you can see how nice and small, you see, nice and fine that end or that tip is. And because it's sharpen-free, that tip is going to remain like that until the end of its life. So I can get in here, I can go and I can really access some of these smaller areas. I can take it subgingivally, and I'm not going to be afraid that I'm going to alter this tip. So once again, bringing it all sort of full circle, going back to what we were talking about initially. And for this one, I'm going to use my M23 Slim, which is a new favorite of mine. I was a longtime user of the 204S, which I still love. However, let me show you here. I find that the slight differences between the two, so here is my 204S, here is my M23 Slim. I find the M23 Slim to be slightly less cumbersome, and maybe personal preference, but I love the way this adapts to the distal and the mesial surfaces of the tooth. Anyways, I digress. Let's get back to my point. So here we are. We were talking about the control. Okay, so all of those elements taken into consideration here. I have the non-slip grip. I have a wider diameter. I have sharp cutting edges that are going to remain that way for the lifetime of the instrument. And all of those things are going to lend themselves well to that slow, intentional, controlled stroke that we were talking about. We're going to overlap those strokes. We're going to go about 1 millimeter at a time. We're going to wait until we feel that calculus and then apply that moderate lateral pressure. And we're going to ease up and do more exploratory strokes. All of this with heightened sensitivity. I come across calculus. Again, I apply that lateral pressure to remove the calculus in a very controlled manner. Calculus is gone. I ease up. I rely on those exploratory strokes, trusting my tactile sensitivity, and only apply as much pressure as needed to remove that calculus. This is going to reduce the lateral pressure we need, the strain on our muscles, but it's also going to preserve cementum and enamel and help our clients to have a more comfortable experience. Well, I hope that that has been a helpful session. I really do appreciate your time. I would love to invite you to reach out to me by email if I can help at all. The team at Curion is always open to hearing from you and helping guide you with instrument selection or education. Anything that you need, let us know. We are here to help. Thank you so much and have a great day.